Good afternoon. I am Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. A huge thank you to Urbana Mayor Diane Marlin, as well as UPTV and our producer, Jason Liggett. Thanks for setting this up today. Good afternoon, Julie.
Good afternoon. How are you?
I'm doing great. Better than could be expected. I want to ask you a question and a follow-up from our last interview. You mentioned that our county is in good shape because we had pandemic preparedness for years. At the national level, is that not the case? Is that why we're seeing hotspots and outbreaks other places?
Well, no. I mean, everybody should have had pandemic planning. I think some places took it more seriously than others, but no, everybody was required to have pandemic plans. And I just know that we had a lot of people involved in our planning here, which is not the case everywhere. You need multi-jurisdictional, multi-level, multi-agency, multi-everything pandemic plans, because it's not just one place that's involved. It is literally the entire community.
One of the things I keep hearing, especially from New York Governor Andrew Cuomo, is that there's going to be serology testing on antibodies. That seems to be the key. How close is Champaign County to that?
We think that probably by the end of the month, we're hoping to have that. The antibody testing is definitely something that we've wanted, but the piece that's missing right now, even once we get a test that is approved and that's validated and that we know is accurate, what we're still waiting on are the studies that tell us if infection and therefore antibodies confer immunity. So in other words, just because you have had this, the idea has always been then you are immune to it. But honestly, those studies have not come back yet. So while that will be good information to know, its usefulness will be kind of modulated by what the studies tell us.
So if everyone wants a test, everyone can have a test. That was a direct quote from the leadership a month ago. Is it true anybody can have a test at this point?
No, that's still not true, unfortunately. However, in our community, what I can tell you is that if somebody has symptoms, they will be getting tested. People can reach out to their healthcare provider. If they have symptoms, they can also call our COVID hotline, which is 239-7877. So people with symptoms will probably be getting tests. So they need to call us or call their healthcare provider, be assessed, and then we'll hopefully be getting more people tested.
I've heard you say, and I've heard medical professionals say as well, that we're at least a year away from a vaccine. How do they predict how long that takes? How can they make that assumption that it could be next April or May?
Well, that's because, this is the fastest vaccine development that's probably ever happened. I mean, they are really, really moving on it. And typically vaccines, they're not really profitable, so there's not all that much interest in doing them. So they wait until they get like a really, really, really good candidate for a vaccine to then move forward with the testing that has to be done to make sure that it's safe and effective. So I know that Bill Gates just put billions of dollars into basically taking all comers so that they can start looking at it and not having to wait so long. So they've already got some human trials going on of different vaccines. But even if you have the perfect candidate vaccine, you still have to go all the way through those trials. Even if they're somewhat less than like normal, they would still need to be proven safe and effective, because you don't want to be giving someone obviously a vaccine that isn't safe. And then the other level of that is it takes so long to ramp up production of it. So whatever vaccine they create, they have to be able to manufacture it in huge amounts to be able to get everyone covered. So that's why they know that it will take at least a year from when they first started trying to make them.
I understand you may or may not know the answer to this next question, but I want to ask it. Let's say next year there is a vaccine and people start to get it like we do a flu shot, and then we get herd immunity. Are you then immune to COVID-19 for a year like you are the flu strain, or is it a lifetime, or do we know the answer yet?
We absolutely do not know. That's the kind of things that they're looking into. We don't even know right now, which is kind of the issue that I just mentioned about antibody testing. they're still studying this to find out if you have a natural infection to it, does your infection confer immunity to that? And that's not, unfortunately, like we know that happens with flu, but we don't know with this if that is indeed the case. So they are still looking into that, and that will, if it doesn't, that would be very disheartening. That would be very disheartening if it does not prove to be something that you can get immunity from either through infection or vaccination. That would be depressing.
On a more upbeat note, of course, as you can be in this situation, Illinois' numbers, of course, Cook County, very high. Champaign County, where do we stand at this point?
Right now we're at 95 cases, and we've still had the 4 deaths, which are, very upsetting, but not, and we're thankful that they're not higher than that. We have had, most people have recovered from this already. I believe there right now are 6 hospitalizations. But what is most exciting to us right now is that our doubling time, meaning the time it takes you to double the number of cases, seems to be up to about 15 days right now, which is really, that's really encouraging for us. We are still waiting to see if we're going to see a bump from the holiday activities of last weekend, 2 weekends ago. We're still waiting to see if that is going to change, and we have had a lot more calls about people with symptoms. So it is possible that we're going to see a bump from that. So that's good in the sense that we're keeping our healthcare system protected, but unfortunately that does not mean that we can let up on social distancing and a lot of the things that we're doing now.
The school year has been canceled for the rest of this school year. Many summer activities have been canceled. Let's say there's a scenario where we do go back to school in August and then another outbreak happens again. Is there a scenario where we go right back to where we are right now in the fall?
Yeah, of course. That's, their pandemics always have a second wave. And just like what we did with the first wave, trying to hold it down as low as possible, we want to prevent the second wave, because again, you don't want to see, here's what it looks like. I always have to use my hands for everything. You've got the little, the first wave, and then you don't want to see the second wave, which is typically bigger. We don't want to do that. So whatever we have to do to prevent that, we're going to do. And it is, Illinois has done, I think, a great job, but it's still, look at it. We've still had a tremendous amount of loss of life.
I read a great op-ed this weekend that said there is a really good case to be made for curbside or delivery only. People going into grocery stores, we have cashiers and stockers getting sick.
Yep.
Do you think that we're moving towards that?
Certainly that would be my recommendation. I know that the governor's office and the Illinois Department of Public Health are always looking at that. If I ran the world, we would have more being able to be outside, doing things that you can do solitary, like, or in your family unit, whether that's sitting in a park or walking in a park or being at the lakefront if you happen to be in Chicago, or going to a beach as long as you can stay away from people and stay in your own cohort, fishing, things like that. I would prefer that to even continuing to allow the grocery stores and the big box stores and things to be open like they are, because unfortunately, and we hear this from the workers there, we hear this from all kinds of people, and all you have to do is drive by there this weekend by any of the stores and you would see that they were just packed. They're just packed. And we hear from people working there that it's obvious that some people are using this more as entertainment than certainly going out to get essential supplies. And unfortunately, you are still only to be going out for essential supplies. So that does not mean, just going in there and wandering around and shopping because you're bored or things like that. And I definitely know that it's boring out there for people, and I know it is stressful for people, and I know, all this is going on, but the things are being done that way for a reason. And yes, I would prefer to see let's say the staff that are working in the grocery stores, rather than being cashiers and rather than being bag people, whatever you call them, baggers, and rather than restocking shelves and things like that, to focus exclusively on using those same employees, but using them in a different way to either deliver groceries or to do efficient drive-through type of grocery distribution. Or I say groceries, but it could be any number of things.
As we speak, there are people in Springfield lining up at the Capitol to protest the shelter in place. We are all frustrated with this. It sounds like you would like to move towards protecting us now in the short term and doing as little as going outside. How does that balance with the people that are protesting? What can you tell them in that we're frustrated too?
Well, right. I mean, for somebody to think that you need to go out there and stand and risk infecting yourself in order to show that this is a frustrating and very difficult situation is pretty ridiculous. All they're doing is causing, they're going to seed outbreaks. That's exactly what they're doing. They're standing out there. Again, you can go outside and walk or do whatever, but what they're doing is they're coming together from different places. They're gathering. There were barely any masks. There was not social distancing. It's just ridiculous. That's all I can say about it. There are plenty of other ways to express your dissatisfaction with something rather than standing out, risking infection. What I don't think people understand is not only are they risking infection of themselves, but they can drag it back home to their family, their kids, their partners, their parents, anyone. And it's also upsetting because if you notice, the first responders are out there trying to deal with this, and people are getting right up in their faces. That is risking their health as well. I saw that happen on some of the video. And then it also is, I'm sure on their way home, they're going to stop off somewhere and get a Coke or a coffee or something. Guess what? They risk exposing the cashiers. And then you go on home and you happen to get sick later, then you're going to be exposing healthcare workers. So the whole concept of the protest to go out and risk infecting yourself to prove a point is completely ridiculous.
That dovetails nicely into my next question. This weekend, I got in trouble on social media. I was driving by a park and there was a group of teenagers, boys, playing soccer. I posted in a local website that maybe the parents should come get them, break up the game. Even though it's soccer, we're not touching the ball. There's no way to do safe social distancing. I don't want the cops to get involved. Do I call the cops? I mean, I got schooled that it wasn't my business.
Well, it's everyone's business, actually, but it's the same kind of thing. We try to get the information out there and try to give people ideas of alternate things to do that do not risk infection. But yeah, I don't know. I don't know what to tell you on that one. I don't think that necessarily, depending on where they were playing, I know that the park districts would not allow people out there doing things that they're not supposed to be doing in their parks, especially during this time. But, there are a lot of places that people can play. But yes, everyone has an opinion on Facebook, and I am often the reciprocant of that. I'm getting those.
I'm not trying to be the police, but I want people to make good choices right now. And should we just stay out of it? Because I would happen to be driving by because I was taking my parents groceries. So I'm trying to keep them safe. It sort of is the ball rolls downhill is what I'm trying to say.
Yeah, that's pretty much exactly what happens. And I saw a great cartoon this weekend that just about summed it up. There's the giant virus rolling down a hill. The population is at the bottom of the hill. Everybody is the healthcare workers, the first responders, the public health, the policy makers, everybody is like standing, trying to hold the ball up. And then you've got people on the other end with a stick trying to push it down and undo everything that's we're trying to do. So yes, it's I can't tell you what to do on that. It depends on your level of tolerance for Facebook abuse.
I keep hearing about testing. I've gotten emails, ask Julie about testing. Is it that we're not getting the test? Is it that the labs are overwhelmed with the tests? Can you just tell me exactly once and for all? And I'll ask you this every week.
Yep.
Why aren't we at the level of testing that people assume that we should be at?
Well, nationwide, there aren't enough tests, period. And states are having to fend for themselves in a lot of ways, which is just very unusual situation. But in Champaign County, we are fine with testing now. We have enough testing to test everyone that needs to be tested that has symptoms. Luckily, those numbers have gone down as well. So, the testing is continuing to happen. But there needs to be a lot more testing, including like the antibody testing that we're talking about. So not just the PCR testing, but additional testing if we are to really get a good sense of what's going on. Again, we still need that information on what do these tests mean. So we know that the antibody test, if we get some that are safe and effective, we still need the research to be done to say, do we have immunity? Can we, with confidence, say that someone who has antibodies to this cannot be reinfected? And that's really what we're looking for.
And so there are thousands of scientists out there working on testing and a vaccine. Hundreds. Make us all feel better that this is not our life forever.
Oh, no. There are brilliant people all over the entire world working on these problems, all over the world. And they will get worked out. It's probably because everyone's been in quarantine and we have zero sense of what day it is, what month it is, where I am, what's going on sometimes. We have to remember we're not very far into this at all. The first test or the first positive case in the United States wasn't until January. We're still very new. This is a very new virus. This is a very new everything. But there are brilliant people all over the world, including right here at the University of Illinois, working on these issues. And so it will get figured out. And again, this pandemic will end. They all end.
Last week, we gave a spotlight to the hardworking people in your office. This week, I'd kind of like to give some love to Jim Hires and his staff at the Eastern Illinois Food Bank. There are lines, there are people out there working. The food banks are longer. Can we give a lot of credit to that organization today too as well?
Yeah, they're doing a great job, and food banks all over the country are doing a great job. And it's a kind of an unusual situation too, because they are used to getting food from all kinds of other places, big restaurants, caterers, all kinds of places that they're not getting now because they're not really working. Same thing with grocery stores. Grocery stores are selling out of everything. Well, not selling out of everything, but you know what I mean. They don't have as much left over to then donate to the food banks. So, but they are keeping up. We have a local food pantry here at CU Public Health that goes, it's on Thursdays. And last week we had 215 cars come through that. And that is over double what we've ever had. So, if people want to donate money, absolutely think about donating it to local food pantries so that they can continue to buy the food from the food bank and continue to serve our community.
And I do want to also thank our friends at Feeding Our Kids who are helping to get food to the school-age children who don't have that pathway right now.
Yeah.
Julie Pryde, I want to ask you last question. Your website, your Facebook page, where's the best place to get up-to-the-minute information?
Well, our website is updated every day at 4 with the new number of cases and also information on it about, it's kind of a breakdown of the zip code and different information like that. All of the different guidance is on there. So if you ever want to go back and look and say, what is the guidance for a school? What is the guidance for whatever? It's on there. Our Facebook page, we put things on there all the time. We have a hotline, so if you think that you need testing, you can call the COVID hotline at 239-7877. And then we have an email to get questions answered. I answer questions through you, and I answer questions through a little column in the News Gazette, and pretty much if anyone calls. But the coronavirus email can also answer questions for people when we're not here answering questions, so they can answer that. And that's coronavirus@c-uphd.org.
Urbana Mayor Diane Marlin, thank you for letting us continue to do this series. Today is our 8th one. We'll keep doing it until there is a vaccine or a cure. I want to thank Jason Liggett from UPTV. It's been great having you as our producer. But most of all, thank you to Julie Pryde. You're the administrator of the Champaign-Urbana Public Health District, and we couldn't do any of this without you. Thank you.